This year at BTOG 2021, we will be presenting some of the data from the OnCovid study, which is the largest registry that has looked at the impact of COVID-19 in patients with cancer, with all types of cancer. And in particular, we'll be presenting the most recent data on the UK impact of COVID-19 in patients with cancer. We have a registry that now contains more than 3,000 patients diagnosed with COVID and treated for cancer across many different institutions in Europe. And what we have sadly found is that the likelihood of experiencing an adverse outcome was much higher in UK patients. So the mortality from COVID-19 was 1.5 times higher in the UK population, in the UK subcohort of the OnCovid registry, which includes patients from Italy, Spain, UK, and many other countries in Europe. And also we found that the determinants underlying this increased mortality had to do essentially with the higher frailty of patients with cancer in the UK in particular. So when we looked at the UK data from the OnCovid study, we were actually quite surprised because there was a strong view over looking at UK outcomes specifically because the UK is the country where there has been the highest COVID-19 related mortality overall. So as of today, April 2021, we're counting over 127,000 deaths from COVID-19. We have had phases with very high transmission. There has been the so-called UK variant, which seemed to be sort of more, aggressive or certainly spreading faster. So there was a strong rationale to look at UK in particular as an area characterized by potentially worse outcomes. And when we confirmed these, we really wanted to sort of have take-home messages for the practicing community and see what is it that we could improve now that COVID is sort of meant to, unfortunately, stay with us for much longer. I think what the results are showing is that the UK patients are definitely more flailer, are characterized by worse outcomes, and I think this has practice informing implications. The rollout of vaccination is heavily imprinted on age as the key factor. Comorbidities are often taken into account, but I think in the cancer community it's actually quite important that we recognize that patients with malignancy, especially those that have got a higher comorbid burden that are of older age, should be prioritized for vaccination. And I think now that the vaccines are available in the UK, every clinician that looks after cancer patients should really be thinking proactively at obtaining vaccination for their patients as soon as possible. It's also true that some patients may not fully benefit from the vaccine, so there is evidence to suggest that perhaps B-cell malignancies, hematological malignancies, that are also the ones that are characterized by worse outcome overall from COVID-19, might have a weaker immune system. So there are a lot of data gaps in cancer patients that hopefully will be filled by academic studies in going forward.